Welcome to the JEADV podcast, the official podcast of the European Academy of Dermatology and Venereology. I'm Adriana and I'm your host. Every month, the JEADV chooses and highlights 4 articles in a section called Editor's Picks, and today we explore the Editor's Picks for November 2024, selected by the JEADV Associate Editor Professor Emek Kokartuk-Gonçu. Acute Urticaria, urgent need for updated treatments and research. Comorbidities worsen itch and quality of life in chronic nodular prurigo. EAD recommendations, elevating eczema care with patient-centered targets. And Microbiota balancing act in hand eczema. But before we get into that,
JEADV offers a whole program of courses with theoretical and practical training covering a range of topics in beautiful locations across Europe. Find out more at JEADV.org and subscribe to our main list if you would like to be the first to receive updates on when course applications open.
And now, the Editor's Picks. Editor's Pick 1. Acute Urticaria, urgent need for updated treatments and research. Although acute urticaria is highly prevalent, limited evidence and recommendations exist. According to a review by Badlow et al., corticosteroid addition to a second-generation oral H1 antihistamine did not improve acute urticaria symptoms in 2 out of 3 RCTs, and combination of a first-generation H1 antihistamine and H2 antihistamine intravenously was most effective for urticaria relief in 2 out of 5 studies. Newer, more effective drugs are needed for AU treatment, and studies regarding current options, i.e. the role of frequently used corticosteroids with longer follow-up, are needed to guide the optimal treatment for acute urticaria. Editor's Pick 2. Comorbidities worsen itch and quality of life in chronic nodular prurigo. Chronic nodular prurigo is a pruritic skin condition with frequent comorbidities, characterized by the development of nodules due to scratching. Pereira et al. Evaluated the association between clinically relevant comorbidities, for example diabetes and hypertension, itch intensity and quality of life impairment in 513 adults with CMPG treated in 12 European countries. Conditions not typically involved in the pathophysiology of itch also appeared to be related to the perception of itch. Careful management of comorbidities in patients with CNPG is important to potentially alleviate itch intensity and improve quality of life. Editor's Pick 3. EAD recommendations, elevating eczema care with patient-centered targets. International expert dermatologists drafted the Aiming High in Eczema, Atopic Dermatitis (AHEAD) recommendations, suggesting that disease severity should be assessed using both physician-reported and patient-reported outcomes. Physicians should discuss results with patients or caregivers, aiming for targets to optimize patient outcomes. The ultimate treatment goal is a satisfied patient with minimal impact on quality of life, clear or almost clear skin, and no or minimal itch. They also established a novel patient-centered minimal disease activity concept, where patients or caregivers choose 1 to 3 atopic dermatitis symptoms or features most important to them. Physicians select corresponding patient-reported outcome measures, and both discuss optimal targets. Editor's Pick 4. Microbiota balancing act in hand eczema. Vindines et al. Assessed the understudied relationship between the microbiome and self-reported hand eczema, hand hygiene practices, and moisturizer use. Individuals with hand eczema showed a more dysbiotic bacterial community over time, with an increase in Staphylococcus associated with active hand eczema. Frequent hand washing as well as moisturizer use was linked to lower alpha diversity, i.e. decreased variety of bacterial species. In conclusion, while regular hand washing is essential, excessive washing may reduce bacterial diversity and increase susceptibility to certain skin conditions, and specific moisturizers that support skin barrier function should be recommended. So just to recap, our first editor's pick was Treatment of Acute Urticaria, a systematic review by Badlow and co-authors. Our second editor's pick was Chronic Nodular Prurigo, association between comorbidities, itch, and quality of life, by Pereira and co-authors. Our third editor's pick was Combining Treat-to-Target Principles and Shared Decision-Making, international expert consensus-based recommendations with a novel concept for minimal disease activity criteria in atopic dermatitis, by Silverberg and co-authors. Our fourth editor's pick was Longitudinal Analysis of the Skin Microbiome in Association with Hand Eczema, Hand Hygiene Practices and Moisturizer Use, by Vindines and co-authors. As you know, all of the research presented today can be found in the Journal of the European Academy of Dermatology and Venereology, and although you can find free access and open access articles, EADV members benefit greatly by having access to all of the articles and content. A special thank you to all of our listeners. If you haven't already, make sure you subscribe on Apple Podcasts, follow us on Spotify, or you can find us on any major podcast provider. It really supports our channel. And we appreciate you joining us and look forward to presenting more interviews, research, and topics of merit. Until the next episode, take care of your skin.